Jimmy Buffett died last weekend at the age of 76. We have since learned the Margaritaville singer died after a 4-year battle with a rare, aggressive form of skin cancer called Merkel cell carcinoma. And here to talk about this is Dr. Mary Evers, a dermatologist with St. David's Georgetown Hospital. Thank you so much for being here.
Thank you so much for having me.
So Merkel cell carcinoma, what exactly is that?
So as you said, Merkel cell carcinoma is a rare aggressive skin cancer, and it's also known as a neuroendocrine carcinoma, and it's derived from the Merkel cell. Not too many people know about a Merkel cell, but its main function in the skin is touch. So when we touch something and you feel a texture of something, it's your Merkel cells working.
When we think of skin cancer, I think a lot of us think of basal cell or the scary one, melanoma.
Sure.
And this is worse. How is it different?
So it's different due to it's much more rare, less than 3,000 cases annually, and the type of cell that it's derived from, that Merkel cell. And there's certain areas of the body that are more concentrated Merkel cells, such as the face, lip, fingers, hands.
So does it have anything to do with the sun? I know Jimmy Buffett, he was a sun worshiper, as a lot of people are here in Texas. I mean, it's hard to avoid the sun.
Right.
Is that, does that factor into Merkel cell?
So it does. However, about 80% of Merkel cell carcinomas are due to the Merkel cell polyoma virus, whereas the remaining 20% are due to factors such as fair skin, age over 65, extensive sun exposure history, and then immunosuppression. And included in immunosuppression is lymphoma, which I hear he also had.
Okay, so I know a lot of people at home right now are, another virus? What exactly is this virus? How do you test for it? How do you know if you have it?
So I don't believe there's any random testing that you should go out and have done. It was actually just found in about 2008 at the University of Pittsburgh, and it's called the Merkel cell polyoma virus. So it's its own separate virus, and a great majority of the population would actually test positive if we were to test everyone.
And why is that? What makes it so common, and what would cause it to go haywire?
So I think those are answers that none of us really know. That would be the answer for cancer. But what causes the cells to go haywire is probably genetic mutation or DNA damage to the stem cells.
So once again, we're here in Texas. A lot of us spend a lot of time in the sun. What would you recommend to people, whether it's avoiding Merkel cell, which is the more rare, but there are many other skin cancers that are much more common?
Exactly. So first thing I always tell my patients is sun avoidance if possible, which is hard to do here, but if you can avoid the sun between 10 and 4, or do everything before 10, after 4, and then you want to do other things for sun protection, such as wear your hat, sunglasses, sun protective clothing, and then a good broad spectrum sunscreen.
Let's talk about sun checks. When should we start to get, or skin checks rather, when should we start getting screened, and how often?
Yeah, the cancer societies all recommend that anyone over age 18 have a skin check. Now, a dermatologist is a great person. If your primary care does a good skin check, then that would suffice. But if you have a strong family history, you may even want to include maybe preteens in that age group too.
Okay, we are out of time, but Dr. Mary Evers, thanks so much for joining us.
You're welcome. Thank you very much.
Of course.